You hear me?
Yes.
Hello. Hi
Oh,
there.
let me clean my mess up.
It's all good. Thank you for doing this. Let me start by
No problem.
it's good to see you, even from afar.
I know. It's like everyone's been isolating, so
Oh,
or a mask, so it's like you're trying to make out
yeah, so you're
food.
looking like, do I know them? Well, welcome, welcome. You are my first person on Zoom, and I wanted to keep the speaker series going, so
Yeah.
I brought back a crowd favorite.
Yeah.
Welcome, thank you for the people tuning in. I'm Wayne Hawkins. This is Train to Perform Speaks. We're going Zoom now, and we are here to speak on health, fitness, wellness for the community. And today we have Dr. Jamila Owens-Todd. I'm gonna,
Hello.
I'm gonna let you talk a little bit about yourself, and then
Yeah.
I'll get into the topic, and then I'll just shoot questions at you, and we'll talk.
Oh, cool. All right. Well, I'm Jamila Owens-Todd. I'm a naturopathic doctor. So I've been in practice going on 13 years now. Numbers get fuzzy once you get past a decade. So what naturopathic medicine is that I focus on people and just trying to give them options in health. So we think about a traditional medical system and following a very kind of pharmaceutical path. I try to think about how do we support you through the foods that you choose, maybe through nutritional supplements, herbs, use something called homeopathy, which really ties in the mind and the body, because naturopathic medicine is mind, it's body, it's soul. So it's healing from the core, from within, and really trying to get to the root of what's going on with the body. And just to give a quick example, people say, well, how does that apply? It's like I go to the doctor, I may have high blood pressure. High blood pressure is a huge concern. I'm pretty aggressive with it, but I think about what are all the factors that are contribute to the high blood pressure. It
Right.
is the diet, it is sleep, it is stress, it is working shift work. There's so many variables and factors that we don't always consider with healing, and so naturopathic medicine kind of aims to bring those factors in and try to help to release how those are putting a hold on your healing, further complicating and causing imbalance.
That's awesome. That's awesome.
Hmm.
And, today's topic, obviously, it's COVID-19. So I
Yes.
thought we would talk about this thing called the immune system.
Yeah.
For our audience who doesn't know what that means, like,
Mhm.
what is the immune system?
Yeah, so the immune system is just this very intricate but yet simplex system that works within you to heal the body. And
Right.
I always give this example. If you cut your finger, your body sends a signal to that's the immune system, and it says we need to heal this cut. And
Right.
so that cut, you get little inflammatory mediators, which, little chemicals that go to heal that cut. That cut clears up, you get a scab, and it goes away.
Right.
So those inflammatory mediators are great friends of ours until they linger, until there's a constant threat, a constant pathogen. And then that's where the immune system kind of gets overwrought and it's tired and it's fighting, but it's not necessarily winning the fight. So
Right.
the immune system starts out with something called the innate immunity, INNATE. And that means that's the body's healing without us doing anything.
Right.
And then we're exposed to many different pathogens. Number one pathogen actually comes through the food. Am I eating the food that's best for me? There's not a perfect diet. It's the diet that's best for you. Some people can't do gluten. Some people can't do dairy. Some people can't do meat. Some people need meat. So it's like what foods are helping you to reduce the amount of pathogen that you receive in the gut,
Right.
because the gut is where we make a lot of those immune cells.
Right.
So the immune system constantly working to heal you, and constantly warding off exterior threats that come from outside that we bring into the body. Allergy season, pollen is a threat. It's like we're exposed to it. It creates a stimulus or a reaction, and the immune system mounts, and
Right.
we get a buildup of inflammatory cells called mucus,
Right.
and then we get snotty, congested, that causes sneezing.
Yep.
Okay.
I'm on.
So back right here, he's like, yes, that is me. Some other things we think about: bacterial infections,
Right.
rashes, itching, like all of that is the immune system reacting. A fever. We learn that a fever is one of the best mechanisms that you have to ward off pathogen,
Right.
bacteria or viruses. The body says there's something here. We're going to increase this temperature to try to kill these cells.
Right.
Then we have to say, well, wait, where is this lingering? If this is not improving, if the cells aren't dying off in a day, that fever continues, now we need assistance.
Right.
Okay. And so the immune system always there to help you, but it can be overloaded and overrun. And what happens with viruses specifically, viruses are, they kind of rely on you. They come into the system and they're kind of seeing if you're thriving, I'm thriving.
Right.
And so we have to do things to isolate and to destroy and to kill the virus because it has the ability to what we call proliferate or just grow. One viral cell attaches and they keep growing and they just get bigger and bigger.
Right.
Okay.
So go ahead.
And so with the virus, depending on the type of virus, we know common cold is the rhinovirus. We get it, we get snotty, 3 days, it goes away.
Right.
Our bodies have become accustomed to it, so there's an immunity that's built up. So when we're presented with the rhinovirus, we deal with it. We have that memory in the innate immune system. Oh, we've been here before. We can attack it 2 to 3 days, it's gone.
Gotcha.
It comes back every year for some, twice a year for many. And then you get the flu, which is a harder hit virus. It can knock you down a little bit harder. It's because the type of virus it mutates more aggressively than a rhinovirus.
Okay.
What we're faced with now is the coronavirus, COVID-19, which is new, not a new virus, so to speak, but it's a new mutation that we haven't really experienced in the human body.
Right.
So coronavirus has been around for ages. They've been studying it. Pathologists, immunologists know about it. But this version of it in the human body is what's getting everyone a little bit concerned.
Right.
So yes, it is a virus. It operates in the same way. It comes in the body, wants to grow. We got to fight to get it out. The interesting thing about this virus is that it can go, the numbers can drop so that the replication, ability for the viral cells to grow decreases.
Right.
But it has a very interesting feature where they start to grow back again. Okay. It's called a cytokine storm. So the immune system is like, okay, we're calming this. It seems like I'm fine. But then these cells start to kind of mutate within the body, rapidly grow again. So my suggestion to everyone, whether you're symptomatic or not, is stay on the immune stabilizing protocols for a month, 2 months, 3 months.
Okay.
And it could be as simple as vitamin C, or as simple, or maybe not so simple as cutting sugar out. All of the things that further suppress immune system are going to be problematic in the event of trying to keep your immune system strong. So it's not so much adding things, it's also what am I doing to suppress?
Right. So let's talk about people are dying. It's scary.
Mm-hmm.
Who's at risk out there? Who's at risk?
Yeah.
Is it grandpa? Is it 12-year-old little Johnny? Like, who's at risk?
Yeah, so immunocompromised, and what that means is someone who has a pre-existing condition or may have an autoimmune condition. Mm-hmm. Children are typically, their immune systems aren't robust until after 7, 8, definitely going into the preteen years. But this virus is uncharacteristically something that's not problematic for children. Okay. It just, there have been cases, let me be clear, that have died. Yeah. So elderly, we know that as we age, our immune system decreases. Signs of that is, elderly the mobility, having decreased mobility, or temperature variations. Those are all signs that the immune system is taking a little bit of a hit. That's a natural, unfortunately, progression. But when in the wake of a virus like this, a pandemic, you have to take extra caution. So unfortunately, there are all these theories. And then fortunately, there are a lot of theories. Again, because there's so many studies that are going on right now, one of the newer things and I don't want to get overly technical, but one of the newer things they're linking to some of the deaths is a cardiovascular event. Okay. And so what that looks like is, remember I talked about the cut, right? The immune system says there's a cut, it sends little cells. Right. You do that in the wake of a virus. You send these inflammatory cells. Well, inflammation heals for a short amount of time until it stays longer than it needs to. Right. Now it's a concern. Right. So inflammation on day 2, day 5, day 7, day 10 is problematic. So if I'm taking cold medicine and I'm trying to decongest and I'm doing all those very traditional antivirals and not thinking about the inflammatory response, I'm not really fully addressing the immune system. So we have these specifics. Here's the allergy med, here's the cold med, here's the flu. But
Right.
what about the inflammation that it's now we're getting the intel that this is a major part of this viral cascade, which is what is attached to many of the deaths as they go back to research.
Gotcha.
So even more of a reason to say, yes, I'll take my, vitamin C and echinacea and, elderberry, but I also might need to add in turmeric and ginger
Right.
as the anti-inflammatory, because that's where the prolonged immune effect is actually causing a
Gotcha.
rapid decline in the hospitals. So
Okay.
they're seeing that the lungs are filling up with fluid. There's this very aggressive that fluid is inflammation.
Okay.
So it's the initial thought is fluid in the lung. That's a mucus. That's a cold viral kind of symptom. But to fill up that quickly and fill up that rapidly, it has the assistance of inflammation.
Gotcha.
And so some of those cases have been, I don't know if they're diagnosed, but the last article that I read the other day was about strokes. The resemblance of a stroke in many of the patients who have died with COVID symptoms, and when initially I thought it was just the lung filling with fluid.
Right.
And so that speaks to literal just locality of inflammatory cells in the chest cavity affecting the heart, because your heart is very affected by stress. An immune cascade, an overwhelming amount of immune cells or viral cells, that's a stressor to the body.
Right.
Because the body is trying to keep up. It is trying to heal.
Right.
And it just takes you into the spiral. So heart rates are elevated is what they're finding. Cardiovascular events, that includes a stroke. I don't think MI or heart attacks were attached, but usually it was elevation of heart rate or tachycardia.
Okay.
And then the associated stroke, where it's the blood vessel is just kind of tightening and creates constriction. The other thing is the clots. So clotting is another factor of long-term inflammation.
Okay.
And so blood clots, they can be very tiny particulates that can travel through the bloodstream until they form together and form a clot. Okay. And that's just kind of the nature of blood cells, is that they're moving through. But with inflammation, tiny little blood cells, you get clots form.
Okay.
So it's very complicated and very intricate.
It sounds like
yeah, but luckily, I mean, it's like there more and more science is coming out. It just can't come out fast enough.
Yeah. You got that exception to the rule, a la Angela Bassett, who's in her 60s.
Yeah.
Looks like she's in her 40s.
Yeah.
What are other ways that your immune system can become compromised or weakened outside of lack of mobility and age being a risk factor?
Diet is the biggest.
Okay.
Diet is the biggest. And I mean, I know this is a pandemic, and I've been to the store and I see the carts full of potato chips and people,
can't even find them.
Right, fighting each other, right. It's like you're like elbowing each other for orange vest soda, it's and I really, I've never been through a pandemic.
Right.
I don't think many of us at this age,
exactly.
You look too young to have survived the Spanish flu. So, so I can't really tell people what they should do. I want to be really clear on that.
Right.
When I started reading the science, I'll be honest, I was really shocked at the way this virus was attacking. And what you don't want is a room of specialists saying, I don't know what this is.
Right.
And that's kind of what was happening. I mean, I tried my best to follow the research, and it's been like this. It's starting to get because the other thing is they couldn't do autopsies in China. Because it was an infectious disease, you can't then reopen the body.
Makes sense. That makes
so
sense.
There was, and that's, in the medical field, that's how you learn, open the body up. So there was just a very large preponderance of lack of information.
Right.
And so my first thought, my household was, and I could be a bit extreme, was, all right, we're getting rid of meat.
Yeah.
And I'm not a vegan. Okay. But the thing about that is this is a zoonosis. So certain viruses can thrive in the animal body.
Big time.
And as we are now seeing these pork plants and, chicken plants and turkey plants, where there's just this large level of infection that's just going through employees, and how it's just being passed from vessel to vessel, essentially. And my thinking was that more so, how do we cut the inflammation? Without even knowing that inflammation was which is now we know is a huge risk factor with COVID and the comorbidities and the, mortality rate. I just thought anti-inflammatory. How do we cut the level of inflammation?
Right.
So animal products are our greatest source of inflammation.
Okay.
Now, do you have to be a vegan? No, but maybe cutting back to 3 servings per week, including eggs. So if you eat eggs and then maybe the next day you save your burger, or, on a Wednesday you eat your, beef tacos or whatnot, because it's just, that's just the nature of those foods, is that they engage a very acidic enzyme pathway in the bodies and they increase inflammation.
Right.
That's without any illness, pandemic, viral episode. That's just how we absorb them. That's how we break them down. So that was a big thing. Cutting out the inflammatory foods, which for me included meat, and sugar.
Yeah.
Which I am Jamila. I'm a sugarholic.
Yeah. Yeah.
So, and sugar, I want to be really clear on this. Sugar isn't just cookies, candies, and cakes.
Right.
It's, I could be what I call healthy and eat granola in the morning,
right.
and have some really good rye toast, with avocado in the afternoon, right. And then have a veggie stir fry with black rice. It could be really great, healthy choices, but that's 3 carbohydrates.
Right.
Carbohydrates break down as sugars.
Right.
So I have to be, in someone of my metabolism, I have to always be mindful of that, even more now, because I'm thinking that's sugar. That's a sugar load, and I really have to reduce the possibility of increasing my inflammation. So animal products and sugars, which I say sugar / excessive grain carbohydrates.
Okay.
Dairy should go without saying. Dairy has a protein, casein, 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 that is known to increase an inflammatory response. Right. A lot of people drink milk and they get all snotty. We say that, and that's because that's inflammation. Your body's saying, what is this? It's milk. Yeah. Now, could you have some really great organic feta cheese or really great, organic Greek yogurt? Possibly. Again, your metabolism. It definitely wouldn't be a food of choice daily during all of this. Right. But possibly 2 to 3 times a week. And then it's just observing. I think being in a state of anti-inflammatory and immune boosting, if your energy's well, if you're sleeping well at night. And that's it's like, we're not just looking for the cough, cold symptom, right. Am I breathing? It's like, do I have energy right now?
Your lifestyle.
Sleeping is one of the best medicines that we have at our fingertips.
Talk about that a lot in the gym. A lot.
Yeah. Yeah. So if I'm sleeping, whatever you need, 7.5 to 9 hours at night, right. You're regenerating these healthy cells. The immune system, you're getting out, you got a mask on, but you're still fighting. The immune system is still dealing with, pollutants in the air. It's still dealing with depending on the chemicals in the mask, it's still dealing with noxious substances. So it's not like that mask totally blinds you and keeps you or masks you from all pathogens. You're still exposed to something. So the rest phase at night is your best immune builder. Yeah. So I've suggested to some of my patients, they're like, well, I feel fine. I'm like, well, let's maximize your sleep. Well, I sleep okay. I'm not a big fan of taking melatonin daily, but if that's going to get you sound sleep at night, I'd rather you do that during this time as your number 1 immune booster, as opposed to taking a bunch of vitamin C. Because now you're really engaging the immune system in a way where it's going to do its job because it's rested enough, because it's been restored, it's been rejuvenated, and it's ready to go.
Right. Okay.
So the diet is huge. And I've been invited to a number of happy hours, Zoom happy hours.
Yeah.
And I said, I'll show up, but I'm coming with a glass of water.
Right.
Because as much as I love a Malbec or a nice rosé, I ain't having it right now. Right. Because just for me, I just think I don't want to take any opportunity to compromise my immune system. Right. Now, here's the catch, right? How do I deal with my mental health? Because that rosé might be saving some marriages, right. Or keeping kids from being kicked out on the street. So I want to understand.
True.
It might be rosé, or I'm kicking these kids out, or So I think right. You got to weigh what works best for you. Yeah. But the mental health, I cannot speak enough to how, if I had any kind of PSA, that is where the long-term mental health effects of this is where I'm concerned.
Yeah.
Because, I mean, our lives are upended.
Yeah. Big time.
Income,
Yep.
once the stability of keeping a roof over your head is questioned, you're not thinking about,
Yeah.
a virus. So they're saying, all these people are crazy. They want to get back out. Yeah, people want to make money. They have, it's not like they want to go into the war zone, but they have. A mortgage company is like, yeah, we'll give you a few months.
Right. Yeah. That's it.
That's it.
Our money.
Yeah. So I really feel like if I had any area to support people would be on dealing with this and understanding that this is a trauma.
Yeah. Big time.
And the possible or the reality of PTSD post this is a bigger detriment to our immune system.
Yeah.
Than, going out with the mask on right now. It's so to me it's a combination of things. So I suggest doing things like teas. I love teas.
Yeah.
You can stop and get chamomile or lemon balm or Tulsi. Tulsi is a really good tea.
That was my next question was, going forward, are there any supplements or foods that you would recommend?
Yeah, I think going forward, I would say, have a ritual just to calming ritual. Even if you feel like, what, I'm good, add it in anyway.
Right.
It's like some of us will put gas in the car at a half a tank. It's like, oh, it's a half tank. Let me go fill up. Some of us wait till we're down to E and that light's dinging,
Oh, yeah.
No judgment. But I think in this case, because so many things are being thrown at us, physical health, mental health, livelihood, and just the ability to maintain it, I would try to do everything I can to stay on top of that, stay on top of my mental, stay on top. So I'm really, suggesting anti-stress, whatever says anti-stress. There's calm magnesium powder at night, things to help with the sleeping. Tea, I love tea, doing herbal teas, chamomile, Tulsi, rooibos, lemon balm.
Mm-hmm.
I would do a lot of those things that are anti-stress. B vitamins are really kind of helpful to stabilize you. Because what happens in a stress state, you use up your electrolytes. You burn those off, just like with that, exercise, your electrolytes burn off. So water, hydration, go without saying. So that's for all the wine drinkers. And, it's like for every glass of wine, you need 2 glasses of water.
Agreed.
Because you're using that wine to get you through this, but you're burning up the water and those electrolytes. So you definitely have to refuel. So staying hydrated. And of course, you get water and tea. But as far as supplements, I tell everyone, throw everything at it. Vitamin C is a standard. The science has shown that vitamin D has been very effective. Mm-hmm. And it's if I can say this, what I love about this right now is that the traditional medical establishment, they're looking at all of these alternatives.
Right.
It was out of the New York hospital. They said vitamin C is a viable option.
Right.
The research is also showing vitamin D3 at, 1,000 to 2,000 IUs a day has been a good stabilizing factor for immune. But guess what? It also is a mood elevator.
Right.
Now, my go-to herbs for immune, I love olive leaf.
Okay.
Olive leaf is safe for all ages. Long-term and high dosages, it can lower the blood pressure. So positive for some, not so positive if you run low on blood pressure. So it's really meant to be taken for a month. You don't have that negative effect of lowering the blood pressure after a month. But if you're on it for 3 months, I would switch olive leaf for a month, vitamin C for a month at 2,000 milligrams. Olive leaf is like about 100. And these are things that are pretty mild and safe to take with most medications.
Do you have a go-to place for the people's like, I've never taken that, I've never heard of that? Do you have a go-to place, website, or anything?
I probably should.
You don't, it's okay. Because you said the names of them, people could look, we can Google everything.
I say Google. The thing about Google is I always say find 2 or 3 references. So if you go to one site for olive leaf, it's most likely going to be a company.
Right.
You can type in olive leaf scholarly articles.
Okay.
But I normally say, I'm fine with Google. Just get more than one reference. I hate when people just like one reference and that's it. And it's like, there's always an opposing reference. So if you Google olive leaf and just look at least 3 and kind of compare and take notes. I'm not attached to many brands. I mean, there are some really good brands out there. Barlean's is one that it more so for the website to get information.
Gotcha.
You can purchase the product, you can purchase another, but Barleans with the B as in boy, Barleans, they have really good information. So yeah, vitamin C is, and vitamin C is one of those things where you do not have to get a good quality. You can get like the cheapest drugstore vitamin C, it'll still give you benefit.
Right.
Yeah, olive leaf, maybe get a little bit better quality. But one thing that I've been telling people who've been experiencing these respiratory symptoms is I have them boil a lime. Just take a lime, cut it in half, or you can quarter it.
Okay.
A lime, about 3 to 4 tablespoons of fresh ginger root.
Okay.
And you can chop it coarsely and leave the skin on.
Okay.
And then about 2 to 4 cloves of garlic. So you take the garlic bulb, you crack it open and pull out 4 cloves. Throw that in a pot with 8 cups of water.
Okay.
And boil that for 30 minutes.
Oh, wow.
One of the best antiviral drinks that you can have.
Yeah.
It's a lung.
Listeners are gonna be doing that.
It's good. No, it's good. And I say that because what happened was I was getting people who couldn't get tests. That was a whole fiasco at first and early, couldn't get a test, but had every symptom, fever, tightness.
Right.
And then we couldn't find vitamin C. There's like an international shortage of vitamin C. Well, limes and lemons are rich sources, but you want the peel on that lime and lemon.
Right.
And so when you boil it, you release the ascorbic acid. You're releasing a lot of the citrus is a mucolytic, so it breaks up mucus.
Right.
The garlic and the ginger are anti-inflammatory. Ginger is a mover, helps to move stuff out of the lung cavity. Garlic is your best antiviral, antibacterial, antifungal that you have at your fingertips.
Okay.
I am not brave enough to chew garlic by itself. One day I'll do that. Until then, I boil it. Okay. And so that little concoction you can store in the refrigerator. If you take it out of the pot and put it in the refrigerator, the lemon and the garlic, everything in there is a preservative in a sense. It can store for up to 10 days in the refrigerator. Okay. And you only need 1 cup to 2 cups. If you have symptoms, I would do 2 to 4 cups a day.
Okay.
It's a great drink, so you don't have to necessarily go out and buy a bunch of supplements. And it actually, people were noticing that their tightness and that difficulty to breathe was loosening up within the day of doing the 4 cups.
Okay.
It's so really good. It's not my suggestion. I found it from this little old lady out of Madagascar, just baking. Okay. She was serving it on the side in a kettle.
It works.
And they were like, we don't have any cases of COVID. So, I mean, it all makes sense. So a lot of the things we have, it's at our fingertips, in our kitchen.
Okay, so here's what I'm hearing. And if I miss anything. So in conclusion, sleep.
Yes.
Supplementation. Diet, decreasing the meat a little bit for inflammation.
Yeah.
Meditation or some sort of relaxation practice.
Yes, absolutely.
Okay. Did I miss anything on these bullet points so people can continue to write these down?
Of course, movement.
That's our
no, because that's our best anti-inflammatory.
Yep.
So a lot of people are fearful of leaving their house. I realize that's a reality. But I'm like, if you have a floor and about a quarter of a foot of space, you can stand there and march in space. Like right in that little space that you have, just march and move and do some high kicks and high leg raises or knee raises, because that is getting the blood pumping. Our best anti-inflammatory is movement.
Yeah.
I have been getting out. I'm sorry, don't yell at me. I begin to walk. I try to walk in neighborhoods because it's like that's my sanity.
Oh, I've been doing the same. I've been working out twice a day.
Oh, okay.
Once as a fitness workout and once as a walk.
Exactly. Yeah. So that mental, but movement is our best anti-inflammatory. There's nothing like it.
Yep.
So it's like there's whatever you can do, and I know you have some great tools, but what can be done at home. But I that was the one thing. It's like do whatever you can. If you have to put on your favorite jams, rock out, dance 30 minutes. That blood flow, pumping, circulating is what's moving inflammation. Also, it's increasing oxygen capacity. The moment you have to and take in more air, you're healing the lungs.
It's a great thing.
Yeah.
Well, listen, I want to thank you for your time. It's been awesome. You're like officially our house doc. We just made it. Can
I get a t-shirt made or a label?
Don't do your t-shirt. I want to thank you for your time. Thank you for being on my first Zoom trainer speak.
Yay!
How can people reach you if they want to learn more or even utilize your services?
Yeah. All right, I got all these hashtags and handles.
Let's go through all business. Oh, one more thing. Congrats on Golden Grocer.
Yes, yes.
Yeah, can't mention that. Yeah, that's my.
That's all right. That's all right.
I got my mask from there actually.
What's that?
Got my mask from Golden Grocer.
Oh, you did. That was a local designer, Rashad. Yeah.
I reached out to him.
Yeah, he's awesome. So I am at Golden Grocer. I pop in and out. I'm usually there pretty early.
Okay.
I have been doing a lot of Zoom visits with patients, so you can always call me. My number, I tell people, and I have a message that says I will get back to you in 36 to 48 hours. Don't hate me. But that number is 314-677-4041.
Okay.
My website is minthealth.org. That's M-I-N-T, like the mint, and the word health.org. I'm on social media platforms, not willingly, but yeah. So yeah, you can always reach out if you have questions.
Okay.
And you gave me a great idea. I think I'm going to start doing Zooms because these are some of the questions that I'm having.
Right.
So I think I might, if people want them, do kind of regular Zooms or once a month, or just to kind of tap in, because I feel like it's I get it. It's like, where do I go from here?
Yeah.
And
out there, they don't know. People are fearful and just not moving, you know.
And that's what's happening. It's like there's this catatonic, and again, everyone process. We're in a very traumatic time.
Yeah.
So I want to be very mindful of that. And some of us freeze.
Yeah.
You know, and there's a whole, I won't get into this, but there's a whole mental component of trauma where you go into this arrested state of growth.
Mm-hmm.
And so that overcoming that sometimes is literally getting up and moving.
Yeah.
What I will have people on the Zooms just stand up and just twirl.
Yeah.
Movement can be our savior.
Yeah.
And getting us out of that stuck pattern, because in the midst of trauma, we get stuck. So
that's why I'm doing it twice a day. Like I need it.
Yeah. And good for you for realizing that need and then answering the call.
I realized until I went for a walk and I was like, holy goodness. Like I feel like a different person. So I know. Yeah.
Now you see what I mean about those walks.
Oh, yeah.
I said, I don't even count this as fitness. This is all here.
Oh, it's headspace.
Yeah.
Listen, I appreciate your time. I know you're super busy healing people and helping people. Thanks for coming on. Let's do this again before, like if they say we got 3 weeks, let's do one more before then and catch up and see where we are in the community. Okay?
Absolutely. I thank you for considering me, and thank you for even inviting me. I love what you're doing. I just want people to know that you're such a good person, and the way you motivate through movement is amazing. I mean, you've just had me rethinking my form of movement and exercise, and I've been to a lot of trainers. So I value you in that way. You're such an asset to the community. So
thank you. I appreciate that. Well, we'll connect again.
Okay.
All right. Take care.
All right. Bye.
Bye.